Hello, so this is chapter 5 of Concepts of Chemical Dependency, Alcohol Use Disorders. A working definition of alcohol use disorder. Such disorders exist on a spectrum. Use alcohol despite medical, social, legal, interpersonal, and vocational consequences. Multiple attempts to reduce or control use. Continued use despite knowing that it causes or exacerbates medical issues. Dependence can result from 16 ounces of 80 to 100 proof of liquor in 11 to 15 cans of beer each day for 2 to 3 weeks. The person with AUD or alcohol use disorder typically will experience any of a wide range of medical, social, legal, or vocational consequences associated with heavy alcohol use. Scope of the problem, 1 of 2. Globally, 3.3 million persons die from alcohol-related illness or injuries each year. In the United States, 80% of those over 12 years of age have drank at least once in their lives, and just over 1/4 of adults have been drunk in the last month. About 29% of adults will meet the criteria for AUD at some point in their lives. Approximately 13.9% of the U.S. population is thought to have active AUD in a given year. The estimated economic impact of the alcohol use disorders in the United States was $234 billion, with 13% of this amount for associated health care costs. The financial costs of AUD are between 1% and 6% of the gross national product in the United States. Who is the typical person with an alcohol use disorder? The typical alcohol-dependent person in the United States will experience their first psychosocial or medical problem in their age between 20 and 30. And they will probably first seek treatment after 40. AUDs are more common in males, 17.6%, than in females, 10.4%. Only about 5% of heavy drinkers fit the Skid Row image. So who is the typical person with an AUD? Table 5.1 subtypes. Okay, so this non-problematic, subtype non-problematic, percentage of sample 68. Select characteristics, low tendency to exceed limits, possible family history. Moderate, which is 25.6%, age between 20 and 40, likely male, smoker, gambling, use of cannabis. Select characteristics likely to have some endorsement of use in larger amounts and longer periods than intended. Likelihood of using in hazardous situation, inability to stop or reduce, exceeding drinking limits highly probable, and low likelihood to seek help. Some familial history of AUDs, misuse. Severe, 5.4%. Above plus use of opioids, major depressive disorder, and separated/divorced. Select heuristics, likelihood of scoring high on 6 AUD criteria, including use of alcohol in hazardous situations, use in larger amounts in longer periods, inability to stop or reduce, and significant likelihood of exceeding limits, low likelihood of seeking help, possibility of significant health consequences, possible history of alcohol use disorders in family of origin, moderate rates of depression. And then subtype extreme, 1% about, age between 20 and 40, history of suicide attempts, smoker, gambling, major depressive disorder, use of tranquilizers, familial history, of alcohol use disorders in many cases. High likelihood of endorsing all 11 criteria of for AUD. Physical dependence, tolerance, and craving, one of two. Continued alcohol use leads to tolerance, as the body adapts to the continuous presence of alcohol. Individuals with an AUD often come to depend on alcohol for psychological support, as well as to avoid physical withdrawal symptoms. Ongoing use leads to alcohol withdrawal syndrome. So physical dependency, tolerance, and craving, 2 of 2. Table 5.2 here is the effects of alcohol on a chronic drinker. So 0.05 to 0.09, none to minimal effect. 0.10 to 0.19, mild. Euphoria. 0.20 to 0.29, mild emotional changes. 0.30 to 0.39, drowsiness, lethargy. 0.40 to 0.49, coma, death is possible. 0.50 to 0.60, respiratory paralysis that may result in drinker's death. Breast, in 2004, discussed how, on rare occasions, a patient with a measured BAL, or blood alcohol level, of up to 80 might be alert or conscious, although such exceptions are rare, and usually a blood alcohol level of 0.50 is fatal. Complications of chronic alcohol use, 1 of 7. Alcohol is thought to factor into the loss of 2.5 million years of potential life each year. Habitual heavy drinkers lose up to 25 years of potential life compared with non-drinkers. Although alcohol-induced organ damage is beyond question, aging and genetic inheritance are also important variables. Digestive system. Lower nutrition absorption, vitamin depletion, and pancreatitis. Liver. Between 80 and 90% of individuals will develop early manifestation of fatty liver. Individuals will develop alcoholic hepatitis. Between 10 and 35% of individuals with alcohol-induced hepatitis will develop cirrhosis, and there's also a risk of hepatitis C virus. Circulatory system. Alcohol use increases coronary heart disease by as much as 600%. Alcohol use increases the risk of hypertension. Heavy alcohol use is associated with an increased risk of death from stroke, but more for women than men. Alcohol is described as cardiotoxic, as it may damage heart muscles. Complications of chronic alcohol use, 4 of 7. Central nervous system. It can impair memory formation without inducing loss of consciousness, so blackout. Anterograde amnesia, cerebral atrophy syndrome, Wernicke-Korsakoff syndrome, confabulation of suggestibility, disconnected syndrome, and tardive dyskinesia. Sleep-related effects. It is known that chronic use of alcohol also interferes with normal sleep cycle. 60% of those with AUD suffer from insomnia. By suppressing REM sleep cycles, chronic use of alcohol interferes with cognitive functions during waking hours. Peripheral nervous system. Peripheral neuropathy develops in 15% of chronic drinkers. Exacerbates pre-existing mental disorders. Depression is seen in 40% of AUD cases, and anxiety is seen in 10 to 30% of cases. AUD is often intertwined with psychological struggles. Suicide is 58 to 85 times as likely to take place in alcohol-dependent persons as in those who are not alcohol-dependent. Increased risk of sleep apnea and aspirations from ammonia. Other body systems. Regular drinkers suffer from a variety of sexual dysfunctions. calcium loss for both men and women, causes 40 to 50% of deaths in motor vehicle accidents. The alcohol withdrawal syndrome is a two-phase syndrome where the sudden reduction or cessation of alcohol intake causes the neurons begin to work erratically due to the disruption of the balance between excitatory and inhibitory neurotransmissions. Symptoms begin 6 to 24 hours after last drink. It is indicative of physical dependence. Severity of AWS depends on the following factors: duration and severity of alcohol use, overall state of health, and concurrent SUDs. The alcohol withdrawal syndrome. The Clinical Institute Withdrawal Assessment for Alcohol Scale Revised assesses severity of AWS, measures 15 symptoms such as anxiety, nausea, and visual hallucinations. Maximum score of 65 of alcohol withdrawal. So 0 to 4 minimal, 5 to 12 mild, 13 to 19 moderately severe, and 20 plus severe. And it can be repeated to monitor. And then alcohol withdrawal syndrome. Alcoholics' hallucinations develop in about 10% of cases with AWS. Seizures are more common in more severe cases of AWS. Approximately 1/3 of individuals experience delirium tremens. Current medical practices attempts to block the development of the DTs with benzodiazepine during withdrawal instead of waiting for them to occur. So that's it for this video. Thank you for listening.